Bronchitis is a very common problem that any doctor will see in a clinical setting. Bronchitis is inflammation of the air pathways of the lung. It leads to buildup of mucus and a chronic cough. Now, in Western medicine, how they treat it is, if they think it's bacterial and they can isolate it, they'll give you an antibiotic and they'll tell you to take acetaminophen for the discomfort. Basically, not a very good treatment, especially for the chronic bronchitis. Now, how do we approach bronchitis in TCM? It's very interesting. In TCM, there's different types. There can be cold bronchitis, hot bronchitis. There can be blood stasis bronchitis. It's very, very difficult to figure out which one it is without knowing how to read a pulse. The key to Chinese medicine is pulse diagnosis. That's why I've spent the last 25 years teaching it all over the world. If the bronchitis in TCM is determined as a heat bronchitis, then we use herbs that simply are anti-inflammatories and herbs to clear the phlegm out of the lung and to stop the cough. The other type of bronchitis in TCM is cold-based bronchitis, where the lungs are actually cold. If you touch REN 22, this area near the throat right here below the voice box, if that area is cold to touch, that bronchitis is very unique. It's not an inflammatory bronchitis. What's actually in the lung is a cold condition. For those people, antibiotics will never work because antibiotics are very cold. The way you fix this in TCM is you heat up the lungs. Use herbs which are very warming, and you use herbs to clear phlegm out of the lungs by warming up the phlegm so you can discharge the phlegm. The third most common type is blood stasis bronchitis. This is a particular kind of pulse in the right yang way that's called a block pulse, that I call a block pulse, which means it's very bad circulation to the lung. The way you get rid of that bronchitis by strongly moving the blood to the arterioles of the lung. It really, really works well.